Thank you, Mr. Speaker. Members, this is a pretty straightforward amendment. If you've served in this body before, you've seen a similar amendment in the past. And basically what this amendment does, like Mr. Leach said in his amendment, he's trying to address needs that are not being met currently. This amendment to the amendment would also address needs that are not being met currently in the state of Texas. Currently, we have over 5 million uninsured Texans. We're a leading state when it comes to the leading state when it comes to the number of uninsured and the rate of uninsured. We lead, unfortunately, in maternal mortality rates. The last decade, the state has consistently rejected tens of billions of dollars in total. Dollars that would provide vital health coverage to more than 1 million Texans, adults, children. We know that increasing access to care saves lives. According to the 2022 study by the Texas Maternal Mortality and Morbidity Review Committee, about 90% of pregnancy-related deaths in Texas in 2019 were preventable at some level. That's an issue that our colleague Representative Rose has worked very hard on, among others. According to the National Library of Medicine, expanding Medicaid is significantly associated with lower maternal mortality rates. Not only that, but increases access to preventative care that results in Texas hospitals saving $360 per patient. That'll decrease hospital inpatient costs by millions of dollars each year. In every state, every state that has expanded Medicaid, children have gained coverage alongside their parents. When Virginia began Medicaid expansion enrollment in January of 2019, for example, more than 25,000 children were also enrolled in Medicaid and CHIP. Here in Texas, a Texas A&M Bush School study estimates that if Texas expanded Medicaid, 954,000 newly eligible adults would enroll in expansion, bringing approximately $5.41 billion in federal dollars annually to this state. Members, this body, we have unfortunately continually voted against Medicaid expansion for the last 10 years. We are now one of only 10 states in the country that has not expanded Medicaid under the Affordable Care Act. North Carolina was the most recent state to join 39 other states in expanding Medicaid because they recognize it's the right thing to do. And these are red states, there's blue states, there's purple states, there's all color states that are expanding Medicaid because they understand it makes good economic sense, it makes good health care policy, and it's the right thing to do for their citizens, like it is the right thing to do for our citizens in the state of Texas, and that's why this body should vote for this amendment to the amendment.